If you are over 60 and you have quietly started planning your entire day around your bathroom schedule when you can go, whether you will go, whether what happened this morning was enough, or whether the pressure and the heaviness is going to follow you through the afternoon, I need you to stay with me for the next few minutes because what I am about to share with you is not another list of things to eat more of. It is not another reminder to drink water, and it is not something that requires a prescription. What I'm going to walk you through tonight is something most men your age have never been told. Not by the label on the fiber supplement sitting in their cabinet, not always by their doctor, and certainly not by the company selling them the laxative they have been depending on for the last 2 years. Here is the part that matters most before we go any further. The discomfort you are feeling, the bloating, the straining, the feeling that something is always stuck. That is not your body failing. That is your body asking for something different. And there is a very specific thing you can do tonight before you sleep that begins to change this. Not in theory, in practice, in your body. Starting tonight, stay with me. Before we go any further, if you are watching this and something in those first few sentences already feels familiar, drop a comment below and tell me where you are watching from. I read every single one. And if this kind of honest clinical conversation is what you have been looking for, hit subscribe. There is more where this came from, and the next video connects directly to what we are covering today. Here's the first thing I want to dismantle because it is the belief that keeps men stuck sometimes for years. The belief is this: constipation after 60 is just aging. The gut slows down. That is what bodies do. My doctor checked everything and said it was normal. I want to be careful here because there is a version of that which is true. Things do change. The muscles in the gut wall lose some of their coordination. The bacterial communities in the intestine shift. The nerve signals that tell the colon to move become quieter. These changes are real. But here is what most men are never told. Changes and nothing can be done about them are not the same sentence. And there is something else, something more specific and more important than the general idea that the gut slows with age. Your colon is not a pipe. It is a muscle, a long, living, coordinated muscle with its own nervous system built directly into its wall. Researchers call it the entic nervous system. There are more neurons in the gut than in the entire spinal cord. The colon does not move passively. It contracts in organized waves. It has rhythm. It responds to signals: warmth, volume, position, movement, the stretch of a full stomach after a meal. And like any system built on rhythm, it can be disrupted. It can be silenced. It can be trained into patterns that no longer serve it. Most constipation in men over 60 is not a plumbing problem. It is a rhythm problem, a coordination problem, sometimes a hydration problem, sometimes a nerve signal problem. And when you treat a rhythm problem by forcing a contraction with a stimulant laxative night after night, you are not solving anything. You are deepening the pattern you are trying to escape. Keep that in mind as we go through this together. My name is Dr. Reena. I am a board-certified urologist with 12 years of clinical experience, and a significant portion of my patient population has always been men over 50. Urological health and digestive health are more connected than most people realize. The same pelvic floor muscles that control urinary function are directly involved in how the bowel moves and empties. I see the overlap every single day in practice. And in 12 years of those conversations, I have noticed something I think is worth saying out loud. The way most men understand what is happening in their body when this becomes a problem, what is causing it, what fixes it, what is actually going on, is significantly shaped by marketing rather than physiology. And that gap costs real people real comfort. So let us close that gap together. The countdown: 7 things happening in your body after 60 that nobody explained. Number 1, your colon's morning signal has gone quiet. There is a reflex in your body called the gastrocolic reflex. When volume and warmth arrive in an empty stomach after a night of fasting, the stomach sends a signal forward to the colon. We are open. Begin the next cycle. In younger men, this reflex is strong and reliable. After 60, for many men, it has become a whisper, not because it is gone, because it has never been properly activated. The single most impactful thing you can do is work with this reflex deliberately. Half a liter of warm water drunk slowly before coffee, before food, before anything else in the morning. Warm, not cold. Slowly, not gulped before anything else. That sequence matters. Coffee on an empty stomach has a mild diuretic effect. It pulls fluid out before the reflex can use it. Warm water first gives the gastrocolic reflex exactly what it needs to fire. Most men who do this consistently for 5 days notice something has shifted by day 4 or 5. Not dramatically, quietly. The way the body is supposed to work. Number 2, your stool is dry because your body is quietly borrowing from it. Here is something almost nobody explains about how the colon works. The large intestine is the last stop. By the time stool reaches it, most of the nutrients have already been absorbed. What the colon is managing at that point is almost entirely water, how much it pulls back into the body and how much stays in the stool. After 60, the sensation of thirst becomes less reliable. Many men are chronically mildly dehydrated without feeling particularly thirsty. When that happens, the colon compensates by pulling more water out of the stool. The stool becomes dense, dry, and slow. The straining gets worse. The pressure builds. This is not a fiber problem. This is a hydration problem that fiber alone will not solve. And in fact, and this is important, taking a dry fiber supplement without dramatically increasing water intake can make things measurably worse. The fiber absorbs whatever water is available in the colon, including the water that was keeping the stool soft. Bulk increases, softness decreases. Men feel worse and wonder why the fiber is not helping. The fiber that works is the fiber that arrives already wet, whole flax seeds soaked overnight in water. By morning, the seed is surrounded by a thick, clear gel mucilage released from the seed's coat. That gel lubricates the colon wall. It softens stool from the outside, not by pulling moisture away, but by adding moisture that is already there. Use the seed and the soaking liquid together. Do not drain it. That gel is the entire point. Number 3, your pelvic floor is holding on when it should be letting go. This is the part that almost never gets discussed in general health content. And as a urologist, it is one of the first things I look at. The muscles of the pelvic floor, the group of muscles that form the base of the pelvis, the same muscles involved in urinary control, play a direct role in bowel function. In many men, especially after years of straining, these muscles have developed a pattern of tension. They tighten when they should release. The body has learned to brace rather than let go. And no amount of laxative addresses that pattern because it is a coordination problem, not a chemical problem. A simple and accessible way to begin working on this is diaphragmatic breathing in a supported squat position. Feet flat on the floor, knees above hip level if possible, a small step under the feet if needed. Slow breath in through the nose, expanding the belly downward. Slow exhale through the mouth, allowing the pelvic floor to soften with the breath out. 2 to 3 minutes of this in the morning paired with the warm water begins to repattern the reflex the colon needs. This is not yoga. This is biomechanics, and it makes a difference that most men are genuinely surprised by. Number 4, your magnesium level is almost certainly lower than it should be. Magnesium is one of the most prevalent nutrient deficiencies in men over 60. Intestinal absorption of magnesium decreases with age. Several common medications, blood pressure medications, proton pump inhibitors, certain diuretics deplete it further. And magnesium is essential for smooth muscle function. Your colon is full of smooth muscle. A colon that is working under a magnesium deficiency is like an engine running without adequate oil. The contractions become sluggish. The coordination suffers. The rhythm breaks down. Before adding any supplement, have an honest conversation with your doctor about your magnesium status. It is a simple thing to check, and it is regularly overlooked. For many men, addressing this one gap produces a change they can feel within 2 weeks. Number 5, you have stopped moving enough and your colon knows it. Physical movement is one of the most direct mechanical stimuli for peristalsis, the organized wave of contraction that moves stool through the colon. The colon responds to the body moving through space in a way that sitting in a chair simply cannot replicate. Even 15 minutes of walking after a meal does something real and measurable to how the colon organizes its next cycle of contractions, not vigorous exercise. Walking consistent daily after eating. The colon needs the body to move. It has always needed this. And most men over 60 are moving significantly less than they were 10 years ago, without realizing how directly that affects what happens in the bathroom. Number 6, the stimulant you are taking to help is training your colon to stop. If you have been using a laxative regularly, something with senna, something from the herbal section of the pharmacy labeled natural or gentle, I want to be honest with you about what is happening over time. Senna works by chemically irritating the mucosal lining of the colon. That irritation triggers a contraction. It is effective in the short term. Used occasionally in an acute situation, it is a different conversation. What I see in practice consistently is what happens when that becomes a nightly habit over months and years. The colon adapts. The nervous system in the gut wall adjusts its threshold. The irritation that once produced a reliable, strong contraction begins to produce a weaker one. The dose increases. The frequency increases. The colon becomes progressively less capable of responding to the signals it was designed to respond to: the warmth of water, the stretch of a meal, the movement of a walk. When a patient tells me they used to take one tablet and it worked perfectly, and now they take three and it barely does anything, that is not a sign they need something stronger. That is a sign the colon has habituated. And the answer is not a stronger irritant. The answer is a deliberate, gradual supported reduction while introducing natural motility support in its place. This is not a quick fix, but it is a real one. Number 7, you are taking the evening completely for granted. Here is something that gets almost no attention in conversations about constipation. The colon has its own circadian rhythm. It is more active in the morning after a night of rest. What you do in the evening directly determines how ready the colon is to work the following morning. A large meal eaten late, close to sleep, disrupts the natural overnight rest cycle of the digestive system. Shallow or fragmented sleep, which becomes more common after 60, affects how well the colon's circadian rhythm expresses itself the next day. And going to bed mildly dehydrated, which most men do without realizing it, means the colon begins the night already working against itself. What the evening actually needs is simple. Finish eating at least 2 hours before sleeping. Have a small glass of warm water before bed, not to stimulate a contraction, but to ensure the colon has what it needs overnight. And if you are using soaked flaxseed in the morning, prepare it tonight. Let it soak. By morning, that gel will be ready. What I want you to do starting tonight: tonight, before you sleep, do 3 things. Put a tablespoon of whole flax seed in a small glass of water. Let it soak until morning. Do not drain it. Have a small glass of warm water 30 minutes before bed. When you wake up tomorrow, before coffee, before food, drink half a liter of warm water slowly. Then eat the soaked flax seed with the gel. Add 2 or 3 prunes in the morning if you can. Prunes contain sorbitol, which draws water into the colon gently, and they contain phenolic compounds that have documented mild promotility effects on the gut, not in traditional medicine only, but in actual clinical research. They are not dramatic. They are steady, and steady is what you are rebuilding. Walk for 15 minutes after your first meal. Run this consistently for 5 to 7 days. The effect is cumulative. The first 2 days may feel like very little has changed. By day 4 or 5, many men notice the pressure beginning to ease. By the end of the week, the morning water may begin to do what it is supposed to do on its own. Not because something forced the colon, but because the conditions for movement have been restored. That is a different experience. It is quieter, it is slower, and it is yours in a way that a nightly tablet never will be. I want to say something directly to the men watching this who have been dealing with this for a long time, who has stopped mentioning it to anyone because it feels embarrassing or trivial or just part of getting older. It is not trivial. The discomfort of this affects sleep. It affects energy. It affects how you feel about your own body. It affects dignity in ways that are real, even when they are quiet. And the fact that it has been going on for a while does not mean the colon has forgotten how to work. The colon is living tissue. It adapts, it remodels. I have watched men who had been dependent on stimulant laxatives for years gradually rebuild their own rhythm with patience and the right support. The body does not give up on you, it waits for the right conditions. Your colon was designed to move. That is its entire job. It has been doing that job in one form or another for your entire life. When it slows, when it becomes dependent, when it stops responding the way it used to, that is a signal, not a verdict. A signal about conditions that have changed and that can, in most cases, be changed back. Age is not the end of comfort. It is not the end of freedom. It is not the end of mornings that feel easy. Small, consistent, targeted changes, the warm water, the soaked flaxseed, the walk, the evening preparation, these are not minor adjustments. They are the conditions your body has been waiting for, starting tonight. And if you found something useful here, share this with someone who needs it. Leave a comment below telling me where you are watching from. I want to know. Subscribe if you want to keep having this kind of honest conversation, and watch the next video, because what we cover there connects directly to why so many men over 60 are dealing with this in the first place. I am Dr. Reena. Take care of your body. It is still on your side. I'll see you in the next